first question. This is AAPC and AHIMA certifications. We've had this one before, actually, and we got this question, I think, 2 or 3 times this week alone. So I thought maybe we better revisit it again. So here's one of the sample questions. Hi, I have an associate degree for coding and billing, but haven't worked for the past 2 years, and I'm looking to get certified. My question is this: what is the best certification to get? Which one is preferred by companies, the CPC or the CCA? So let me take you to the answer. And basically, what I jotted down here is hospitals tend to prefer the AHIMA credentials, the CCS, the RHIT. And if you don't know what those are, you can go to ahima.org, I think it is. But mainly, I find physicians' offices, they just want to know that you're certified. So if you have the CPC or the CCSP, which is the physician credential compared to the AAPC, they're normally satisfied with that. The other thing you want to consider as far as which one's preferred is look in your local classifieds. What are the want ads asking for? Do you see more of one than the other? That's the last bullet. Location. If you're in a big city like Philadelphia, New York City, there's a lot of hospitals. So there might be more jobs in the hospital setting versus in a rural area like me, there isn't. There's only 2 main hospitals. So you're probably going to have a better chance landing a job as a new coder in a physician's office. And of course, what do you like? Can you picture yourself working in a large hospital type environment? It's a little more kind of rank and file, almost kind of like military grades and things like that. Or maybe a smaller, intimate physician office setting. You can probably tell by my answer which I prefer. So I do have to preface this with I am biased. I am a physician outpatient girl. I have worked in hospitals as an occupational therapist, but not doing coding. It's a whole different world. And my comfort zone is the physician-based world. So take my advice with that in mind, that I am a little bit biased, and I do tend to steer prospective students toward the physician-based world because I feel it's easier to break into than in the hospital. So now I also had on the slide this AHIMA versus AAPC comparison grid that I did when I covered this question before. Let me see if I can enlarge this a little bit. Okay, so what I have here is different variables, and then the AAPC column and the AHIMA column. So the first variable is the physician-based exam. What is the credential for their physician-based exam? So for the AAPC, it's the CPC, the Certified Professional Coder exam. And for AHIMA, it's a Certified Coding Specialist physician-based credential. If you're looking for outpatient hospital-based exam, for the AAPC, that's going to be the CPCH. And for AHIMA, it's the outpatient aspect is part of their CCS exam. For inpatient hospital-based, the AAPC doesn't have a credential for inpatient. They leave that to the AHIMA folks. And this is the lead credential of AHIMA for coding is the CCS. And this is your inpatient and outpatient. It's a comprehensive exam. Very difficult, in my opinion, compared to the others. I think it's the most difficult. Now, I did want to emphasize that the CPCH, because H means hospital, throws a lot of people off. It only means outpatient hospital. So be aware of that, because I know I took my CPC first, and then I took my CCSP, and then I took the CPCH, and I really put off taking the CPCH because I'm like, I thought it was going to be all that inpatient type coding, and studied for it and everything. And I took the exam, like, wow, this is a lot like the CPC exam. So the difference between the two, I mean, you still need to know all of the CPT type coding, surgery codings, and all of that are covered in both exams, but you do have outpatient reimbursement stuff being asked of you in the CPCH. Entry-level credentials, the AAPC has the CPCA for apprentice, and the AHIMA has the CCA. I think it's apprentice as well. No, associate. I'd have to look that up. Sorry. If someone wants to type that in the chat, maybe Boyd could let us know exactly what CCA stands for. Certified Coding Associate? I don't know. All right, cost of the exam. AAPC charges $300 and you must be a member. AHIMA charges $299 for members, $399 for non-members. So pretty much they're the same. What's different is that the number of exam attempts per fee. AAPC lets you have 2, whereas AHIMA you only get 1 shot. So if you don't pass the first time, you have to pay another $300 to take it again. AAPC gives you 2 tries, which is a good thing because a lot of people need 2 tries. And if that's your case, it's okay. Okay, format. The AAPC is all multiple choice. It's 150 multiple choice questions, whereas AHIMA has 88 multiple choice questions, 18 are unscored. If you look at their, I think it's candidate handbook is what they call it, they tell you that they actually put in some kind of throwaway questions that aren't even going to get graded. So just so you know that. And then 8 multiple select, 2 of which are unscored, and 13 fill in the blank. So a majority of it is multiple choice. And that's why I teach techniques about process elimination and multiple choice and throw out 2 of the 4 answers, because both of them have a lot of, multiple choice questions. The AAPC exam is proctored, normally through local AAPC chapters. So you have to go in person, whereas AHIMA uses a testing center. The length, AAPC's exam is 5 hours and 40 minutes, and AHIMA's is 4 hours. The books allowed, approved coding manuals only for the AAPC. AHIMA allows you to add a medical dictionary as well. So hopefully that will help you. That's a little comparison to AAPC versus AHIMA credentials.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.